afternoon, everybody. Judy Maggio. Welcome to Decibel Dialogue, and today our guest is Matt Mollica, who is the Executive Director of the Ending Community Homelessness Coalition, or ECHO. And you guys have been very busy.
We have, yes.
And going to get a lot busier this weekend, because this weekend is the annual point in time count. And that was one of the big reasons I wanted to have you on, to talk about why this is such a pivotal time for the homeless issue in our city.
Yeah, thank you, and thanks for having me on. I think the point in time count is a count that we do annually across the country in all cities that receive COC or Continuum of Care funding from HUD, and it's meant to try to show the need nationally for funds from HUD. The report goes to Congress every year, and Congress appropriates funding for homeless services here, and part of that will come to Austin.
So you have like about 800 volunteers, am I right about that?
Yeah, we have around 800 right now, and we're hoping for even more, hoping to get close to 1,000 this year.
And how do people sign up, and when does it all start?
Absolutely, so austinecho.org. You can go to our website and sign up and do the training all online if you want to, and then you'll get assigned to a team. Your team lead will contact you, and you'll be off and running, and we'll start Saturday morning, the 25th. Around 2:45, there'll be 3 or 4 shifts of about 3 to 4 hours apiece, and so we'll start around 2 o'clock a.m. and go through 11 a.m.
Our crew went along on the point in time count 3 years ago, and then I went out as a volunteer 4 years ago. And if you really want to understand homelessness, this is a good way to start, to be on the ground and seeing the people who have no place to go.
A great education, not only in who the people are who are experiencing homelessness in our community. You'll also get paired with a larger group that will probably include service providers here in Austin, people who work within homeless organizations here that provide assistance to those experiencing homelessness. You get to pick their brain, talk to them a little bit about their work and what they do and why it's so important. And then when you're out there engaging with folks experiencing homelessness in our community, you get a chance to really talk to them on a more personal level about their circumstances, and you really get a more holistic view of why people experience homelessness here in our country, and more specifically here in Austin.
So homelessness has become a real rallying cry in our city. It's been a real focal point, and there's been a magnification of this constant kind of clash between the state and its priorities and the way they do things at the state level and the city of Austin, which is different than the state. Yeah. And nowhere has that been more prevalent than with the homelessness issue. The governor has been very critical of the way Austin has handled our homeless situation here. So what is the latest with that? I know there was a big article in the Statesman today, and you were quoted, and other community leaders who are on the nonprofits who are dealing with homelessness, saying you felt like the way the governor's been handling the criticism of Austin is destructive.
Yeah, I mean, I think the approach that we need to take right now, where ECHO's role specifically is, we really need help from the state, and we need help from the city, and not only just from a funding perspective, but from a broader support perspective. And it's one of those things where we just don't have the resources to spend, in an issue that's politicized. We have to get as many of these resources out in the community as we can. And I think we have great programs here in Austin to serve people experiencing homelessness, and our focus needs to be on funding those programs and scaling those programs up so that we can end homelessness here. When we have had that opportunity to cut through the politics and really focus on the work that's being done, we've ended veteran homelessness here in Austin, Travis County, and we're close to ending youth homelessness here in Austin, Travis County. We'll be the first community in the country to do that, to end youth homelessness, 18 to 24-year-olds experiencing homelessness. And that goes to show that when we're really able to focus, get everyone rowing in the same direction, the state, the city, all the service providers, we can really affect the issue and get good work done.
From the governor's perspective, he has said this is a public safety issue, and he feels like the way Austin has handled homelessness, that we're not putting public safety first. Would you agree with that?
No, I mean, I think my stance on on some of the governor's quotes has been that, it's our charge, especially here in this community, to take care of everyone, that's part of our community, and people experiencing homelessness are part of our community, and it's a housing crisis. We have a housing crisis right now. It's not a public health crisis. It's a housing crisis. We don't have enough housing for people who need it. And the result of that is people sleeping unsheltered on the streets and not able to meet the other, basic living needs, like a place for their trash, a place for them to use the bathroom or the restroom, and a place for them to shower and to work, to get their hygiene together. And I think, the focus needs to be on housing for people experiencing homelessness. We need to bring more housing, low barrier housing resources to the table. And it's less about a public health crisis, and it's less about that there's more trash or feces or needles everywhere. I don't believe those things to be true. I think that there are always those things as long as we have people sleeping unsheltered in our community.
I think everyone agrees that permanent supportive housing is one of the big solutions to this. But as you said, affordability, it's not easy to find a place where you can build affordable housing in Austin right now. So where are we with that? I mean, everybody knows about Community First Village, but that can't be the only solution. There are other groups like foundation communities that provide low-cost housing for people to get off the streets and get their lives back in order. But where are we? I know there's a hotel that's being renovated. What are some of the other solutions, though, in the works?
Yeah, so Community First Village and foundation communities provide really great housing for people that need it, and need affordable housing or need access to housing that's income restricted. And those are really important organizations that provide high quality housing options for people. We are in the process of working with the city on the Roadway Inn, which is an 87-unit hotel on Old Torf and I-35 that will be low barrier access to permanent supportive housing units. And what that means is, these units will be designated for folks who are experiencing chronic homelessness in our community that might have co-occurring physical health, substance use, or mental health conditions that where they need really intensive support services on site. And so part of what we'll be doing there is providing a service budget that's up to about $1.2 million annually for people to access the care that they need in their home. So it's community-based care rather than them having to go seek it out in other places. We'll bring it to them, provide that support in the space. And we're in the due diligence period for that right now. The city has the hotel under contract and is really working through the inspections, the environmental reviews, and other things in order to make sure that it's ready for our tenants as soon as possible.
So what are some other long-term solutions, though? How are other cities handling this situation? I know that you come from Denver. How does Denver? Is Denver doing a better job than Austin's doing with its homeless population?
Well, no. I mean, I think right now, every community is struggling with with people experiencing homelessness in their community, and right now, other communities take an approach that's similar to the one I think we're getting started here in Austin, where we're going to have permanent supportive housing being built through low-income housing tax credits, like the Terrace at Oak Springs, the Integral Care opened recently. Those are really important projects. Then we have Community First Village and we have foundation communities, and we'll continue to bring low-income housing tax credit properties online over the next couple of years. And then I think we have to infuse the housing stock with low barrier units like hotels, where it's not cannibalizing other resources and it's not going to take 4 to 5 years to get built. When you're buying the land, you're also buying the structure, and along with it comes units that are ready for people to move into that didn't have existing tenants in them that we're displacing. So these are all, it's got to be a multifaceted approach. Plus, on top of that, our Continuum of Care funding, which we get from HUD annually, just increased from $6.8 million in 2019 to what's going to be almost $10.3 million. So it's it's a huge increase. It's our biggest jump in Austin's history that I know of, and it's about a $3.3 million increase from the year before. Is
that based on the point in time count, or why are we getting this new money? And I'm sure that people are applauding it, because certainly we can use it.
Yeah, sure. So it's based on a number of factors, and so really ECHO is in charge of putting what we call our consolidated application. So it's the application that goes into HUD every year for our Continuum of Care funding. ECHO puts that application together with the help of our service providers in our community that receive that funding. And then those projects are scored every year, or the consolidated applications are scored nationally every year. It's a competitive process. And I think we had a really good application this year. And so part of that means we got a bonus project for the SAFE Alliance, or folks that are experiencing domestic violence. And that's a $680,000 project. We got our youth homelessness demonstration program funded fully in our Tier 1 award, which means our first priority awards. And those types of projects, I think, are ones that are unique to this city and are going to be a good resource for us moving forward.
What do you think are the big misconceptions about homelessness in Austin? This really has been a trigger point. There have been calls for people to resign from office or to recall their election. There are a lot of people very angry about the homeless situation. What would you like to tell them? And what do you think are there misconceptions out there?
Yeah, so I think the biggest misconception is that people experiencing homelessness, that there's somehow some relation to criminal activity associated with people experiencing homelessness. And there's this direct sort of community correlation of crime increasing as people experience homelessness, as our number would increase, as our folks who are unsheltered would increase. And I would say, one of the things that was in that article today in the Statesman sort of teased out the amount of folks, that were having calls come in from the downtown locations, and the criminal activity that's happening down there is broadly not associated with people experiencing homelessness. Instead of, a higher percentage of those crimes were happening from people who are housed than were happening from people experiencing homelessness. Not just the the petty criminal activity, but also the violent criminal activity and other things. There's no association, there's no correlation between homelessness and criminal activity. And I think those things are coupled together so frequently, and there's a large misconception out there. And I also think that there's a misconception that people experiencing homelessness have severe substance use or mental health issues as a primary cause for their homelessness, when all the folks that we've been interviewing in our coordinated assessment surveys and that we work with in our homeless management information system, which is our database that everyone uses to document on people experiencing homelessness, those folks identify physical health concerns, people experiencing homelessness, as their primary health factor. So 92% of the folks in our homeless management information system identify a physical health issue as their primary disabling condition, and that only 2% identify substance use as their primary disabling condition. And so usually it's a physical health need, and people who don't have access to proper health care use substances to treat that physical health need when it should be treated by doctors and nurses in the healthcare system.
Are you hopeful that that we will find solutions, and do you feel like this impasse between Austin and the state and how we do our business handling the homeless can be resolved?
Yeah, I'll tell you, one of the things that's been really exciting for me and has felt empowering is that there's a lot of folks who have a lot of different opinions about how to solve this issue, but there's a lot of...
And they probably all tell you.
They do. But there's really this desire to impact homelessness here in Austin on all levels, on the state level, on the local county level, on the city level, within the business community, just across the board. There's this real concern for people experiencing homelessness, and I think once we start to harness some of that energy and sort of organize it a little bit and move it in one direction together, it could be really powerful.
You think there is some common ground there then?
I do. Yeah, I really do. I think I've talked to everyone across that spectrum many times, and all the different people who want to help and get involved, the faith-based community. And I think there's a lot of different ideas about how to get it done, but there's one common goal, and that's we don't want people experiencing homelessness in our city.
So the point in time count this weekend, if you want to sign up, give us that information one more time.
AustinEcho.org, and it's on the home page right there. You can just click on the Register Now button. It'll take you through really easy, take you about 2 minutes, and then there's a follow-up training materials. And there's actually going to be some trainings. We have a training tonight at our office, the Echo office at 300 East Highland Mall Boulevard, from 6 to 9, and we have 2 or 3 more trainings, and we'll train folks right up to the Friday night, the night before the count. The last training is from 6 to 9, so we'll be training all week and welcome anyone that wants to sign up.
And is willing to go a sleepless night.
That's right.
To understand how the folks in our community live on the streets and why
Exactly.
they do.
Yeah.
Matt Mollica, thank you so much for sharing the latest on homelessness in Austin. And thank you all for giving us just a little bit of your afternoon. Enjoy the rest of your day.